So we now move on to our short panel discussion, The Courage to Follow Your Hearts, which is very much on the same theme, realising that some people thrive by finding unusual balances to their career or changes of career. So I would like to invite up Lizzie and Rachna and Nirmala to the stage. As is often the case in healthcare, one comes to work and colleagues have had crises or are ill. I learnt very late in the day that two of our panel speakers who we were expecting to come, one has unfortunately had to go abroad due to unforeseen circumstances and another is very unwell. But to my absolute delight, Rachna and Nirmala have decided to join us. So welcome. If you would like to come and sit down here. So I'm going to start with Rachna, who we've all met earlier this morning. And I've worked with Rachna on and off through the Janki Foundation for many years. And she's utterly inspiring with her work as a GP and talking about working with patients, not to mention the poetry, the publication, the work with Michael West. And this morning she said, I've just had a spaghetti career. That's what I've had. So Rachna, tell us about your spaghetti career.
I mean, it's been completely spaghetti. And when you said to me, oh, how have you managed to integrate things? I don't quite know. It sort of just happened a little bit on its own. To be completely honest, at the moment, I work very, very part-time as a GP, and that's a conscious choice that I think I made a little bit through having lots of different interests, which I figured out pretty soon after I qualified as a GP. I went off and did a degree and then worked abroad and did all sorts of different things. So there was definitely a pull from the heart to go and do something different. But equally, I sort of figured out when I did come back to medicine that there's only so much that I could cope with, that I have a personality that's perhaps different to the other people in my practice. I don't cope in the same way that they do. So I sort of tuned into my own needs and have somehow managed to come up with a balance that's quite hard to balance, in fact. I think it's a tightrope that you sort of walk, and it's all, you know, we all have our own tightrope. So just to give you some idea of the journey, after medical school, I worked in Australia for a year, which I'd encourage anyone to go and do if you're in medicine, just to take a year out and do something different. I think that's where I learned that having a quality of life, which they really have in Australia, is really worthwhile. So I became a GP. I finished my GP practice and I thought, right, I'm a bit bored. What do I do now? So then I did an MBA, and that completely opened my eyes to the world outside of medicine. After that, I worked in Italy for 2 years for a pharmaceutical company, not knowing any Italian, not having any friends. I was a bit depressed for 6 months until I learned Italian and got some friends. But it was a wonderful experience of working completely somewhere new. Italy is a wonderful, wonderful place. The reason why Italians don't like traveling much is because there is everything in Italy. You could spend your whole life in Italy exploring everything, wanting to eat everything, and you still won't have enough time. Life's not long enough. Anyway, I came back to the UK. My life at times has been pull and push. You know, there's been definite movements from the heart. So working with Michael, he just said to me, would you like to work on this project? I have no background in it. I'm not a researcher, but I wanted to work with him and on compassion. So I just said yes. So there have been these moments where, you know, I have just said yes, I know it's the right thing to do. But equally, there have been quite painful moments where I've sort of had to understand that these are my needs, they're not being met. If I don't meet them, who else will? So that's sort of the...
So quite intellectual discussions and realizations in a way.
More than intellectual, I think, you know, even emotional, perhaps even spiritual. You know, this... I'm in charge of my own dignity at work. And actually, if I'm in a context where it's sort of not being respected, and if it's getting close to a really difficult line, then, you know, I have two legs. I appreciate it's not always possible. We can't always run away, and I'm not advocating that. I'm just saying that we have choices, and we have to become aware of those choices. But I think they're personal. That's what I mean about this. This very fine line that we walk. We all have different personalities. I can't cope as much as a duty doctor as some of my colleagues. I would just eat all the biscuits just in order to get through the morning. And I thought, well, that's also not great. But so you have to figure it out for yourself and to have the courage to do it a little bit as you go along. Maybe that's the way to say it.
And do you feel that you're thriving more than you ever have with this current delicate balance, do you think?
So in the moment, yes, I would say yes. If I project my pension forwards, I think I might say I have to think about doing something different. But yes. Yeah, I feel I have the abundance of time, which I think Chrissy made a comment earlier on when, the panel discussion was going to happen. We have enough time. The real problem with medicine is we need to have time with our patients, and when we don't have that, it's really hard to adequately honour the people that they are and the healing that is meant to happen in that kind of place and space. And I think I have that now in the way that my job is structured, or my roles are structured, but actually also finally in general practice. During COVID, my practice thankfully realised that we couldn't carry on as we were. We were all just so tired that one after another, each of us was thinking about leaving. And so we made a simple choice of going from 10 to 15-minute appointments. Now, it doesn't sound like a lot, but it makes all the difference to our patients and to us. And it just takes that extra stress off. No one's left the practice. We have junior doctors that want to stay. So it's a combination of different things. And certainly, I feel very privileged to have been able to choose all of these different things and to sort of do them in some way, and in a way that fulfills me. It's, I think, contributing in some way. It's still in healthcare, it's medicine. There's a little bit of artistry in there as well.
Yes. Thank you. Wonderful. Thank you. So Nirmala, I always think of you as Nirmala with 8 arms, because more than anybody I know, you create and sustain and accomplish so very much. I'm aware that you started off in health economics, and for many years you've been working in the NHS teaching spiritual care and spiritual skills, but you're also currently working in an NHS research job, but still managing to run workshops online, run a whole values in healthcare system internationally online. You're hosting huge number of face-to-face events. I don't know how you do it. So tell us a little bit about your journey.
My journey began with the head, and made full circle back in the head, but the process is I'm now coming from the heart. And that's how I would define it. When I started, I remember in academia, so I'm trained as a health economist by profession, and working in that environment is very head-based, But the challenge came to me when I needed to take a career break. And I had the opportunity when I was in India to have some time to help with retreats. And that opened up my perspective in terms of how spirituality can really be integrated in working people's lives. So the people who were attending those retreats were people from different backgrounds coming for a retreat to sustain themselves. And then I got involved with the Values in Healthcare program. And that for me was the basis of my integrating spirituality in my workplace, and in particular healthcare, because then I worked with the Strategic Health Authority. And for me, with no experience of working in the healthcare system, because I was all academia, in the White Tower, and you think you know how it works, but you don't. And I remember having 1 year as being in the as a project manager in the Strategic Health Authority as a tobacco control and smoking cessation lead. I realized I will never ever, run a lecture session or seminar how I did it before. And because I incorporated the spiritual skills and tools that I've learned from the Vihasa program, and for me, I started putting it into practice, because when we train from the beginning, and I know Arnold is not here, and I remember him tremendously because he was the basis for all of us having done the training, and how he made it very interesting to own it and bring your own creativity. And I was able to put that into practice because Daddy Janki, who was, our, mentor at that time and guiding us, always said, if you don't put it into practice, no one is going to follow you. And for me, that was what I really, honed into. And so during my career breaks and different, transition into the NHS, I had the opportunity to actually share the soft skills, the spiritual skills, the spiritual tools that we use within the Vihasa program and the lifting the spirit and the heart of well-being. And the idea really was enjoying the process. And when you really see people get it, to know how to just take time out and quiet the mind.
And how do you do that in your, no doubt, crazy research job in the NHS? What is your number one skill that you rely on?
My number one skill is my discipline, my spiritual discipline of my early morning time for myself, so my meditation practice, but also utterly important, my half an hour every evening. So all my friends and families know, do not call me between 7 and 7:30, because that's my time. And for me, that's my download. So my whole structure, and of course, having, a partner, husband who's very cooperative, and knowing that time is my time to sustain me. So at the start of my morning, throughout the day, pausing, sometimes I'm not even able to pause, but if I'm able to just do what I do and do it well, and take that time out to unload, that's my time, and I do it properly.
So by the time you get to 7:30, do you feel clear in a way of
not
that
all the
day?
time, no. Not with Vihasa online. But
largely.
Yeah, but I'm so privileged that the people that have emerged and come forward. And I remember, I don't know, Gentiben, if this is something you said to me a long, long time ago, when I started my work in the NHS, and I was so enthusiastic, saying, it's a really good opportunity to do things and, create, a new program. And you said to me, how you live your life, that's how people will see you. And I think I took that on board, and just living my values really was what people see. And when I do a session on mindfulness, or I do a session on self-care and well-being, because that's the focus of what I'm doing at the moment, simple things of allowing people to just experience that peace. And for me, because I practice it, I'm able to share it from my experience, so it touches people. If I didn't put it into practice, they wouldn't get it. So I think when you walk the talk, and this is something that I really love, but walking the talk, what it has taught me is that to be really, really humble. Because I remember coming back full circle. So I started in academia, research, went through the process, and now I'm back in research and development in the NHS, in the trust that I work for. And the idea really is to bring those values. And talking to someone, so my work in the R&D department is connecting with people who have really severe mental health problems, extreme, bipolar disorders, schizophrenia, all these different range of, symptoms. And if I talk to them on the phone, it hit me one day that this is a real person. It's not just someone that's in the head. It's a real person at the end of the line that I'm having a conversation. So bringing into the experience of listening skills, just pausing and getting them to tell their story. And then you having an agenda, which is, to fill in a questionnaire or whatever the research bit is. But first, talking to them as a real human being.
So they're
as
not
a
just
person.
part of the statistic.
No, that comes
Yeah.
late. That comes at
Yes.
the end. And once you're able to connect with them, then just like that, they cooperate. And they said, and you explain to them the benefit of why you're contacting them, because they have the experience. We don't know what they're going through. But if you share what you're going through, then it can help inform policy. And whether that does or not, I'm
Yes.
not sure. But we're doing what we could. Yeah.
Thank you, thank you. And how inspiring to have that BD dose of meditation embedded.
Yeah.
I'm aware of time, so we need to come to Lizzie, who I have had the pleasure of working with for many, many years in Kent. And Lizzie has this extraordinary history of having been trained as an opera singer, and then training as a priest and becoming a hospice chaplain for many years, where you worked in Canterbury, and where we first met when you were in that role. And now you are the director of the Quiet View, which is an amazing retreat centre in Kent, which is so welcoming, and it's wonderful to see how much it is booked and how busy it is and how many people from so many different religions and walks of life find their way to you. So tell us about your journey, and I think in particular I'm interested in the question, has it been a calling? Do you feel you've had choice in it? Tell us a bit about it.
I think, as far as singing was concerned, I didn't realise it at the time, but it was a calling, because I could not sing. It was something I felt I was born to do. And it was only as I grew older and I looked back with a little bit more discernment that I realised that it was a calling, because I felt that I was called to communicate through my voice, through being on the stage, perhaps to comfort or inspire or to challenge maybe or to inform, whatever it may be. It felt like a calling to communicate something, to support people in their lives, and perhaps to bring something which for them became something of the transcendent. And I can remember there were times, particularly if I was singing the top line in an operatic ensemble, I can really say they have been some of the most transcendent times in my life, where I felt, when I was on top of my voice, which wasn't all the time, but there were times when I felt that I was way beyond the world, almost in a non-ordinary reality. And so that did feel like a calling. And so when I really came out of singing professionally in order to become a mum, that felt like another calling. But I have to say, for 20 years, I couldn't listen to opera without feeling pain. So coming from calling to calling is not all a smooth path. It can be a very rocky and difficult and painful path. But of course, the path of motherhood was equally wonderful in different ways. And it was during that time that I felt called to the priesthood, although I ran away from it for many, many years. It's the old syndrome of, no, not me, I can't do that. No, I can't possibly do that. No, not me, I couldn't stand up. No. Until enough people were saying, no, Lizzie. So the interesting thing is that as soon as I took a very wibbly-wobbly step, an uncertain step, at the same time a sure step, paradoxically, and going forward to, in my tradition, the church, to say, I feel called to ordain ministry, after a little while, I realized that restlessness that had been within me and the pain of bereavement of not singing opera had gone. And in following the calling, although I'd been through a lot of pain and a lot of challenge, and following a calling to priesthood is not without pain, it's not easy, and there are many challenges in all kinds of ways. And yet, because I am where the divine has called me to be, and I am fulfilling gifts I had no idea I had, I never have believed I was able to do the things that I'm able to do now. It's only in the strength and the grace of the divine that I've been able to do it. And that's why I can end up happy myself and happy with whoever I may be with in the moment.
So tell us, again, we've just got a couple of minutes left. Tell us about what do you think are the biggest lessons in helping dying people over and over every day, really being with them in those moments? What do you think are the biggest lessons that are now that you've really incorporated into your welcoming, incredibly open approach at the Quiet View?
I think it will be one word, and the word is love. And in my first couple of years as a hospice chaplain, I wasn't able in an interdisciplinary meeting to use the word love, which is what I saw being practiced day by day on the ward. And yet it was a forbidden word. No, we don't do love here. No, actually, this is love. And I think it's love with a capital L and love with a little l. And I think in all my interactions with patients, some patients who, for example, had done the most awful criminal things, if we open our hearts to, and our intention is to channel love unconditionally with compassion, then something changes. The important thing is not to have the intention of changing something for them or making their dying more peaceful or better, although we would like that to happen, but to be with someone where they are without the intention of changing, but with an unconditional loving heart, then the divine channels that love and it goes into all the medical interventions, all the clinical interventions, or all the team interventions, and then I'm going to use the word magic happens, and I've seen many times when people who've been quite traumatized by their dying and their impending death actually have been able to die in peace and with a smile on their face.
And I think that is an amazing moment to end. Thank you all so much, and especially you two for coming with such grace today, this morning. Yeah, thank you all.